Alzheimer's disease gradually diminishes a person's ability to communicate. People with dementia have more difficulty expressing thoughts and emotions, as well as more trouble understanding others. This presentation offers some tips to help with understanding and communication with persons with Alzheimer's disease. When communicating with a person with Alzheimer's disease, it is important to create a kind voice. You can do this by speaking slower, lower, and smiling. Also, don't forget to talk slowly and clearly. To orient the person and get his or her attention, it is important to call the person by name. Always approach the person from the front so there are no surprises, and tell the person who you are, even if you are the spouse or the child. When asking questions, ask one question at a time. Use short, simple words and phrases. Avoid using logic and reason, and avoid quizzing. Also, avoid asking, "Do you remember when?" When talking with a person with Alzheimer's disease, there are a few things to be careful of. Be careful not to interrupt. Don't criticize, correct, or argue. And be careful to let the person know you are listening and trying to understand what is being said. Keep good eye contact and show the person that you care about what is being said. Be careful to patiently wait for a response, as extra time may be required to process your request. And be careful to repeat information and questions. If the person doesn't respond, wait a moment and then ask again. Do not take any negative communication personally. Focus on the feelings, not the facts. Sometimes the emotions being expressed are really more important than what is actually being said. Let the person think about and describe whatever he or she wants. And if the person uses the wrong word or cannot find a word, try guessing the right one for the person. If you don't understand what is being said, ask the person to point or gesture. When it comes to Alzheimer's care, there are choices available. Many caregivers with loved ones suffering from Alzheimer's or dementia are unaware of the options available to them, like in-home care. It is often appropriate and a possible option for loved ones with Alzheimer's to remain safe, active, and comfortable at home.